Russell Myers, CEO of Midland Health, and thank you all for joining us this morning. I'm going to share a few data points, and then we've got a special presentation for you here in just a moment. To begin with, the hospital has a census today of 233 patients as of midnight. 98 of those are COVID patients, 28 of them in critical care with an age range of 27 to 86, 69 in the medical units, ages 24 to 92. We have one child under 5 on the pediatric unit for a total of 98. I think I said to someone in the last day or two that our percentage of out-of-county population has gone down. It is back up at 26% today. We have patients from as far away as El Paso, Waco, and Jacksonville. And if you're not a old East Texas guy like me, you probably don't know where Jacksonville is, but it's about as far east in the state as you can get. So people have come from all over, as is the case with many hospitals around the region. We have a total of 38 patients on ventilators today, and we've been fortunate that the state has helped us to get some more ventilator supply in as we anticipate continued need for high volumes of ventilation. And we'll talk more about that in just a second. ED volume was 171 yesterday, so that continues to trend up. Our employees, our workforce continues to be affected by the virus just like everybody else's. We have a total of 126 of our roughly 2,000 employees who are quarantined at this point. 73 of those are COVID positive. We have a roughly equal number, 124, who are self-monitoring because they've had a meaningful exposure but haven't yet developed either symptoms or a positive test. So a substantial portion of our workforce is impacted by COVID, as is true across the community. Now, I mentioned that we'll be talking about a special presentation. I'd like to call Troy Ward up. We're going to show you what a ventilator is and how it works. It's been interesting. We've recently had some questions come up from actually a number of people who really don't understand what ventilation is, how a ventilator works, how it's used. And so we're going to have a brief demonstration. Troy is coming up now. Troy Ward is our Director of Cardiopulmonary Services, and I'm going to hand it off to him. Troy.
Good morning. Like Russell. Now I'm on. Like Mr. Myers said, I'm the Director of Cardiopulmonary Neurology, Troy Ward. We actually have prepared a little bit of a demonstration as far as what a ventilator is today. So this is a standard ventilator setup for the hospital. This is a Hamilton G5 ventilator. There are many manufacturers out there that do ventilation, but this is our choice of ventilation. I'm going to go ahead and take it out of standby. And as this runs, I've prepared a few statements about standard ventilation. So a ventilator, or what we like to refer to as a vent, is a medical device that can assist or completely overtake your breathing. And sometimes that's needed in order to give the body time to heal and things such as that. When someone is on a ventilator, such as this gentleman right here, we must fully sedate and sometimes paralyze the patient with specialized medications so they don't fight or buck the ventilator. So if you can think about it, if this is you, what's your first thing that you want to do whenever you wake up or anything like that? You're essentially breathing through a straw. So the first thing you want to do is pull that straw out of your airway. So you can understand that sedation and paralytics sometimes are needed. COVID-19 often results in a viral pneumonia. And what that does is turn your lungs very non-compliant or hard. So you cannot take a deep breath, and we have to actually put you on a ventilator in order to give you the specialized ventilatory assistance that this machine provides in order to try and save your life, essentially. In order to do this, we have to do what we call intubate. So if you look here, there is a breathing tube here. It is in the patient's windpipe, and the ventilator is then in turn attached to this breathing circuit controlled by the ventilator. And just a note real quick, prior to COVID-19 and the current pandemic, we usually run about 5 to 10 ventilators per day. And like Mr. Myers said, we're running 38, I believe is what the number is today. So you can see that we're 3 times what our normal use would be at any normal time during the year. So like I said, this is the ventilator. This is, you can see the gentleman's lungs being ventilated, if you can see that. We do also have to secure the tube to the patient's face, so there's no chance that it can be pulled out. And routinely, just one other thing, with these ventilator patients, especially with COVID-19, is we have to what we call prone them. So in some cases, the patient's ability to breathe is even further limited. Well, if you turn them on their stomach, which is what we refer to as prone, it actually recruits some of the lung tissue that's not routinely used with the help of gravity. So if a lot of the times, if somebody does have COVID and you're having trouble, breathing or short of breath, actually laying on your stomach relieves some of that shortness of breath. So, but today, this is our Hamilton G5 ventilator, and an example with our assistance from our lovely mannequin here. So thank you very much.
Well done, Troy. Thank you very much. I thought that was an important presentation. I was surprised to learn that people didn't know what a ventilator is. It's a complex piece of medical equipment, and it's important to recognize that our respiratory therapists are among the true unsung heroes in our healthcare delivery system. They run these ventilators, but they do 100 other things that are vital, especially to critical care patients, and we appreciate Troy and his team very much. A few more points to make, and I'll cede the podium to someone else. We are working actively to prepare to deliver the new antibody treatment from Eli Lilly, which is called bamlanivimab. That's a challenging word to say, but it's the only antibody treatment that's available on the market right now. The Regeneron product may be shortly behind it. It's available under an emergency use authorization. The state has issued us about 200 doses, and we're planning at this point to be ready to administer those the week after Thanksgiving. Our clinicians are still talking about what the right indications are, but in general terms, it's going to be available to the highest risk patients, people who are severely obese, who are over 65 with multiple comorbid conditions, et cetera. We don't have enough of this to go around. It's still not a proven therapy. It's proven enough for the FDA to authorize its emergency use, and we're going to begin to administer it. It's complicated to administer, requires at least an hour-long IV infusion. Preparation before and after that could mean that a patient's here for as much as 3 hours. These will be patients who have tested positive, so they need to be segregated from the rest of our outpatient environment. They also need to be people who aren't in need of ventilatory support yet. They're not ready to be hospitalized, so it's a very narrow group. We'll issue some more details both to our local physicians and to the public as soon as those are ready, but we're looking to begin administering it no sooner than the week after Thanksgiving. Testing, as we were just talking with the city earlier, we're really blessed that the city has worked with us to fund some expanded testing capacity. We are going now till 8 p.m. at our West Campus on Monday through Friday and 9 to 1 on Saturdays. The rules for testing haven't changed any. You have to have an appointment, so call 6-8 nurse if you've had an exposure or have symptoms, and they will work you into the schedule. But this is not all comers testing. We're talking about people with symptoms or with meaningful exposure only at this point. Test results this week, we've tested 740 people in 3 days, so still on our pace to test 1,000 or more a week. The percentage positive has come down just a little bit in those 3 days to about 25%. I'm not sure that's a meaningful drop, but it is a little bit down from the 30% we've been running for a while now. Just a little anecdote that I think illustrates pretty well how full and how busy we are. We are, our policies and procedures here require us to check our status every few hours to determine if we can accept the next transfer request from a hospital that needs our capability, that it has less capability, calls us with an emergency patient they need to move because they can't care for them. We opened yesterday for 2 minutes. And in the course of that 2 minutes, we accepted 2 patients and we closed again. That's the reality that we face right now. For the most part, almost all of every day, we're closed to transfers because we're just overwhelmed with volume that's come through our ER and otherwise, and we don't have the beds to put a transfer in. But when we can open, we do open, and those beds fill almost immediately. Speaking of beds, we have 12 more on the 9th floor that are yet to open. We have some equipment shortages and a couple of other preparatory items. We're hoping to have those open and ready for operation by Monday. It's now looking more like it might be Wednesday, but we are moving as rapidly as we can to get an additional 12 beds open. We're fortunate to have almost 100 staff who've been provided to us primarily by FEMA, a few by the state, but all through the state's resources. Those people are helping us to expand our capacity, and as soon as we can get those additional beds open, we will. As has been reported, we've also asked the state to provide us with a tent that could have capacity of 14 to 16 patients. We probably will use this for low acuity emergency department patients, to free space in the emergency department, to hold patients longer, or to care for the higher acuity emergencies, and give us a little bit more flexibility there. We don't have a time of arrival on that yet. We're still working on the logistics, but that's one more additional resource we can put to use that will help to serve the community. I believe that is all that I needed to talk about. But the last point I'd like to make, we've told you a number of times throughout the pandemic, and since the state's been tracking, you can go to the state DSHS work website and see regional hospital statistics by trauma service area. We're in trauma service area J, which has, since we began tracking, has lagged behind El Paso and Amarillo and Lubbock in the percentage of our beds that were occupied with COVID patients. And the reason we've lagged is not because we don't have a crisis here, we do. We just have a larger number of small rural hospitals in our huge region that really can't take care of any COVID patients. So it's Midland and Odessa where all the patients have to come, and then a lot more small hospitals in the denominator. Well, those 7 to 8% numbers now have crossed the 15% threshold for 2 days in a row, the last 2 days. The governor's order, GA 32, dictates that once you cross the 7 days in a row threshold of 15%, that's 15% of the hospital's capacity taken by inpatients with COVID. Once you reach 7 days in a row, the restrictions on business occupancies go down to 50%. We are on that path now for the first time. And if we maintain this status through Monday, we'll be facing that reduction in capacities. We're obviously coordinating, talking with the city about how to manage that eventuality. But it's one more indication of how serious this round of pandemic spike has become. And as we go through the next few days, we are anticipating we will probably cross that 7-day threshold and have to deal with some occupancy reductions. So at this point, I'll be happy to stop and take questions if anybody has one, and then I'll yield the floor.
Can you go over on your ventilator count? Sorry, this is Tate with Newswest 9. Which ventilators belong to which entity? So how many are yours, and how many are coming from the state, etc.?
We have 44 of our own, and we have a total of 61. So we've received 17 into our inventory from the state. We haven't had to use all those yet. We're using 38 today.
Great to know.
Anyone else?
I don't have any in the chat, and no one else has raised their hand. So, oh, here's
okay.
one.
All right, good.
Can you speak to the demand you've had from smaller hospitals in the region requesting to transfer COVID patients there, or even non-COVID patients?
Yes, it's both. I had some numbers here earlier. It's continuous, and they're ongoing. I mean, I know anecdotally, a few days ago, we have an executive on call every day who, throughout the 24-hour period, is available to help the house supervisor and others make decisions. And one of our on-call executives turned down 15 transfer requests in a single morning on a recent day. That's probably an extraordinary number, but we're turning down requests every day. And people are having to go farther and farther, mostly to the east, to find a place that will take them. There was a story in one of the news outlets I follow yesterday with an Austin hospital administrator talking about the patients they have from El Paso. That's an indication of what's having to happen. As the hospitals in the west fill up, we're all calling hospitals in the east. We haven't had to transfer people out yet ourselves, but we are turning down virtually all transfer requests from the hospitals in the region. And they're having to look to the east because everybody else in the west is full.
Okay. And now Mitch Borden with Marfa Public Radio has raised his hand. So Mitch, whenever you're ready.
Hey, Russell. Thanks for taking questions. I'm curious, how's morale at the hospital, especially after the city rejected the mask mandate and, as more people on the staff get sick?
Well, it's a daily challenge. I think that, we've seen in recent days a nice new outpouring of support from the community. There was a recognition event last night, right, out in front of the hospital as we did shift change. Kit Bredimus, our chief nursing officer, has been our head cheerleader and certainly has been working hard to help to maintain morale throughout the hospital. Lots of good support coming from people in the community. We've at least one group has begun to feed us again on a regular basis, and there'll be more of that coming. So, it's the most challenging times we've ever had. Our people are stretched thin, but we just got the preliminary results of a nursing satisfaction survey that we did recently, and they're very positive. So I think that certainly there's morale would be better if we could reduce the disease. I don't think there's any question about that. But our people are incredibly strong and resilient, and they're in the fight.
Is there any tension between the hospital and the city, especially as you and Kit have been clear that you guys believe a mandate is needed, at least with masks and other restrictions to prevent the spread, and the city clearly rejected that on Monday? So I guess has there been any tension?
Just to be clear, what the city rejected was a very specific mask mandate targeting individual businesses. They had a very lengthy and robust discussion of the wisdom of that. What was clear to me coming through that conversation was that there is no question in anybody's mind about the importance of masking and social distancing and limiting the size of crowds and all of that. That particular solution wasn't the right one for the city council. In the same breath, in the same conversations, we talked about how to continue our discussions about what could be implemented in Houston, in Midland, what would work here. We're talking about the city extending some of its CARES Act funding to COVID-specific initiatives that the Midland Health Group has brought forward, and we'll be discussing that more on Monday. So we and the city are aligned. We don't necessarily see everything exactly the same way, but we are on the same team, and we'll consider ideas, and some will adopt and some will reject, but we'll all continue moving in the same direction. We are fully committed to that. I can't speak for the other entities, I can't speak for the city, but we and the school district and the city and the county are all aligned, talking to each other regularly, doing the best we can to cooperate with each other, both what you see in public and much more behind the scenes. There's tension all around right now. This is the most challenging time I think any of us have ever faced, but we are on the same team and moving forward together.
And I guess my final question is that, you're talking about how hospitals are transferring patients all over the state. Are we approaching a point where Midland Memorial may have to transfer patients and also have to figure out who receives what care in the coronavirus wards and be more limited in who receives what kind of care?
We are prepared for both those eventualities. We've had discussions about both of them. We are not at the point of having to do either of them. We have been very creative in terms of stretching the resources we have. We've gotten great support from the state so that we can do more. More of that support is coming in today with personal protective equipment and a variety of other equipment items. So we've still got more regular inpatient beds we intend to open next week. We've got non-traditional spaces we can use, like recovery rooms that are still being used for their normal purpose, but can be converted if we are in dire straits. And then we do have contingency plans for beginning to transfer people if we just are maxed out. Our medical staff has talked about in a worst case scenario when we were overwhelmed with patients and didn't have the resources to deliver exactly the care that every patient needs every time, how would we handle that? And we've got a very involved process for considering those things. We're a long way from that, but we're certainly closer to it than we've ever been.
Well, thanks, Russell.
You bet.
Okay, we'll ask one question from the chat, and then Scott Pickey, I'll come to you. This is from Tate at News West 9. She says, when are the temporary COVID tents being set up at MMH?
We don't know that yet. We don't have final confirmation from the state that they're coming or when. So we're waiting on that information to come anytime.
Okay, and Scott Pickey, whenever you're ready.
Russell, good morning. Thanks for taking our questions this morning. Doing an outstanding job, and I know you're tired. What, in your opinion, would pump the brakes on these numbers going up immediately?
What would do it immediately? I honestly think that there's virtually nothing we can do to make it immediate. If you track the test results that are already in the pipeline, some percentage of those people are going to get sick and some percentage of them are going to be in the hospital. What we can do immediately that will affect us, 5, 10, 15 days down the road is everybody wear your mask. Particularly, be particularly careful about Thanksgiving gatherings. That's not only a point at which we can continue the pace we're on, we can actually make it worse. As family gatherings happen all across the region, people are going to let their guard down if we're not careful, if we're not really thoughtful. Just because the person you might invite to your house is your son, daughter, cousin, mother-in-law, because their family doesn't mean they couldn't be infected and spread it to your whole family gathering. Anybody who doesn't live in your house, you should treat like a stranger. Keep your distance, wear a mask when you're around them, have your gatherings outside if you can. All of that will just keep us where we are, essentially. We're talking about not making it worse. And the opportunity to make it worse is coming next week, and we all need to be very diligent about that.
Can you handle that? Can the hospital handle that if that happens?
Well, we can handle a little more than we're handling now. As I said earlier, we'll be opening 12 more beds the middle of next week. We expect to be able to use those beds, but once we've filled those, there's not a whole lot more give in the system. So, yeah, we can do a little more, but not a lot.
And then finally, can you talk more about the tent? We're getting the mobile morgue over here. Dr. Saravanan has talked about perhaps setting up a tent at the airport for you guys to share between the counties. He's talked about maybe getting a tent to put on their helipad. It kind of reminds me of a bad virus movie that, we're having to work out of tents now. Is that a sign that things are really getting or heading in a wrong direction?
Well, I'm not sure what a good virus movie would be, so let's start with that. But the tents, just recognize this is an extension of physical resources. If we get a tent from the state, it's a tent. It's climate controlled, but that's it. It doesn't bring people or equipment or medications or ventilators. It's just a tent. It's an opportunity for us to use it to decompress the ER so we can use our more sophisticated spaces for the patients who need it the most. If the state sent us a tent, sent Odessa a tent, it would still have to be staffed. We'd still have to equip it. And it would still be separated from the fundamental resources that a hospitalized patient needs: imaging equipment, immediate access to the lab, ancillary services of all different kinds. So there's nothing magical about setting up a tent, and it's not preferred. I mean, as long as we have spaces inside our building that are adjacent to, accessible to all of those various support services that a patient requires, that's a better solution. I would rather have a tent in a recovery room ward cubicle than in a tent, 10 miles away. That's the way we're going to continue to play this. It's just another resource. And the patients we would put in a tent would be patients who are likely to be in and out. They're going to come get a minor service needed in the ER, go back home, and we'll keep our much more sophisticated monitoring and patient care capabilities inside the main ER for those patients who need those higher level services.
That's all I have. We appreciate you. Thank you.
Okay, we'll ask one from the chat before we move to you, Stuart. This is from Danny Barrera. He says, have you spoken with Councilman Trost regarding his options for a mask mandate?
We actually were talking with Councilman Trost right before this meeting. We'll talk some more. I know the City Council is considering on this coming Monday some not just a mask mandate, but the councilman has offered several suggestions for how we might all work together to take on the virus in a more effective way, and I think those are worthy of discussion.
All right, Stuart, Doreen, whenever you're ready.
Can you address the local politicization of masks, and have we actually found a situation where it's even gotten worse, and is the spike has gotten worse?
I don't know if it's gotten worse, Stuart. I can't say that. I would assume that people are not as diligent as they need to be, or else we wouldn't be having the kind of spike we're having now. The politicization, I don't know. No, I'm not a politician. I won't address that. All we can do is what we do. We continue to preach the masking and social distancing gospel, and we've done it consistently from the beginning. That's not going to change for us. Whether we force people to do it by city or state mandate, or we appeal to their best citizenship sensibilities and ask them to do it for themselves and their families and their neighbors, doesn't matter to us. We just want people to do it. I wear my mask everywhere I go. I take it off to speak when there's nobody close enough to me that can be affected. I take it off when I'm sitting alone in my office, but otherwise I've got it on, and it's not a burden. I've said this a number of times lately. The burden is watching your family member suffer and perhaps die in the hospital when you can't come to visit them because we're dealing with an infectious disease we can't control. That's a burden. Having a tube stuck down your throat and having a machine breathe for you for 14 or 15 days, which is the average length of time someone's on one of those ventilators, that's a burden. This flimsy 2-ply piece of cloth is nothing. Everybody should be wearing a mask all the time, and you shouldn't need a city ordinance to make you do that.
Thank you for all you're doing.
Thank you.
The next questions come. Oh. Come back, Russell.
Wishful thinking, sorry.
This is the last one I have, and then if Clarissa has any, if she doesn't, then we'll.
All right, I'm trying not to hog the podium, but I guess.
This one comes from Tate at News West 9. She asks, would the hospital consider proposing a partnership with the City of Midland to increase testing availability, similar to what the Odessa hospitals are doing?
I'm sorry you don't know we're already doing that. That's one of the things I said earlier. And the city gave us $100,000 a few days ago, and as of this past Tuesday, 2 days ago, we have already expanded testing capacity at our testing site. We were running to the mid-afternoon before this. Now we're going Monday through Friday up until 8 p.m. And then we've added Saturday hours. The first of those will be this Saturday, 9 a.m. to 1 p.m. We are having further discussions with the city about even more expanded testing, and we'll I don't know how long it'll take us to work that out, but we're talking about the possibility of another site. we've got a number of different partnership ideas on the table that the city is considering. So support has already come, and more may be available over the next few days.
Thank you, Russell. Clarissa, do you have any questions that you need to ask him?
Yes, we do. When MMH says they are 12 days behind contacting positive cases, do they mean the tests are completed but the patients have not been notified of positive tests? Or does it mean patients have been tested but the lab has not completed the results? How are rapid tests done by other ERs, including in positive numbers?
Okay, that's multiple questions. So I'm going to answer the first one as best I can, and I'll ask you to repeat them. Number one, it's not MMH that does testing reporting. It's the Midland Health Department. You'll get an opportunity to ask them those questions here in a second. But in general terms, well, let's just leave it at that. Ask the second part if you will.
The second part of the question, does that mean the tests are completed but the patients have not been notified?
Okay. Yeah, I could deal with that. So the testing, and primarily this is a health department question, but it's true across the board. Everybody in town that's doing testing, our site and the commercial sites that are doing it, are doing rapid tests. So you're able to get the results, and you do get the results if you're the patient virtually immediately, within the hour in most cases. Nobody is failing to notify the patients of their positive result. The challenge the health department has is to follow up with those patients, talk to them about the meaning of their results, talk to them about who they may have been in contact with that needs to be alerted to the fact that they're positive. Those kinds of things take a lot of time, a lot of energy. The members of the public, frankly, often don't cooperate. They won't talk to the health department or won't answer their phone. Those are the difficult things. We have been talking to them about how the positive results are reported, and those delays mean the test results that were reported to the patient 10 or 12 or 14 days ago haven't been accumulated and reported to the public yet, even today. We're working together, and hopefully that will get more current in the days ahead, but that's still a work in progress.
Thank you. Another question. Has Focused Care at Hogan requested help with their outbreak?
I don't know the answer to that. I'm sorry.
Is it true that the last week there were no testing appointments available until yesterday, 11/18?
I don't know about that either. I don't think that's true. We've been, as best I know, we've been able to test people either same day or next day pretty consistently, especially since we expanded hours. Now, before the hours expansion happened, we were 2 or 3 days behind for sure, but we're doing more than we've ever done.
Great. We have a question regarding testing and its cost. Is it free? So could you clarify that again for us?
I can't speak to any other testing site, and I'm confident that most other testing sites are charging in some way. But when you call 6-8 Nurse and get an appointment, and you're sent to an appointed testing, a scheduled test at our West Campus, we will ask you for insurance information if you have it, and we will bill your insurance. If you don't have insurance, you don't pay. If you do have insurance, we don't ask for any out-of-pocket payment up front. So no one is paying us any cash to get their test. If you have an insurance company that we can bill, we will bill them. And we've been paid by some of them, but we're doing a lot of free testing for people who don't have any insurance. And we expect to continue to do that. The city's funding helps us continue to do that, to expand that. So while it's not, I'm hesitant to use the word free for everybody. There is no on-site payment required to get your test. And if your insurance company will pay it, we'll take their money because it's a very expensive process. But for many people, we get no payment at all.
Great. I believe you just answered this question previously, but for clarification's sake, we're going to answer this question. If someone calls 6-8 Nurse with symptoms, how long will it be that I get an appointment to be tested?
It changes moment to moment, but I would say in most cases, you could probably get tested the same day. If you call us at 7:30 tonight, we're probably not going to test you in the last half hour that we're open, but chances are we can get you in tomorrow. Typically next day for the most part.
Great. Is the hospital staff catching COVID-19 from the hospital because they are in direct contact with COVID-19 patients or our community?
we don't believe that the outbreak among our workforce is coming from their contact with patients. If you've seen Kit has done a video not too distant past. The COVID unit is probably the safest place in the hospital. We are gowned and wearing the best available respirator masks and goggles and gloves. Anytime there's contact with a known positive patient, our staff are very well protected. So our belief, and we feel strongly that this is the case, is that these are community exposures just like anybody else could. You're not wearing an N95 respirator when you go home or when you go to HEB. You're not wearing a gown and gloves and a face shield in most cases. So we're well protected inside the hospital, and we're as vulnerable as everybody else in the community when we leave this facility.
Can you explain the CARES Act funding, what has been used already to assist, and how much is available?
Well, I'll try. We've gotten at the hospital a little over $17 million in CARES Act funding. We haven't gotten any for quite a while now, for several months. That $17 million essentially replaced the revenue we lost through the month of June, looking at this year's revenues versus last year's. And the purpose of it was just that, to keep us going, keep us fed, recognizing that we've lost volume in the emergency department, in all of our outpatient functions, all the things that keep the hospital going, that keep the lights on. The business that actually pays us, we've not been able to do for extended periods of time, or we've seen significant reductions as people stay home. There are various restrictions that keep us from doing as much work as we would normally do. So that $17 million only covered those revenue losses through June. Since then, we've just been carrying on as best we can. We do know that there's approximately $60 billion more dollars in the original allocation from the Congress. They allocated $175 billion to hospitals, and they've distributed all but about $60 billion of it. We think there's a little bit more to be distributed just in the next few weeks. We're not sure exactly of the formula. We've made our application to get some more money, but we don't know if we'll get it. And preliminary indications are that we won't get much. That most of the money will be devoted to hospitals that haven't gotten anything at all or have gotten very little. So we're not counting on a lot more. We're surviving. We're in good shape. We still have the Medicare advance, not CARES Act funding, but actually an advance payment for future Medicare patients that we are holding. The government doesn't need that money back. They've extended the time period to a full couple of years. So we're in good cash condition. We're getting to the end of the year where we'll be collecting our annual ad valorem tax that starts to come in typically in December, January, February. So we get a big collection of tax money. And then, of course, effective January 1, the new sales tax that was passed by the voters last July will begin to be levied in Midland County, and we'll begin to get that cash as soon as March. So there's other money coming. We're not in danger of closing the doors or laying people off or any of those difficult decisions. But we're losing money every day. COVID, there's a mythology in the community that's, I don't know where it comes from, but that somehow hospitals make money on COVID patients. Medicare pays us a little bit more. There's special government grants to pay for some of our uninsured patients. None of that covers the cost. We lose money on every COVID patient every day. And that's just our reality. And we'll continue to do it as long as the community can support us.
Great. Thank you so much. I believe that's all the questions we have at this time. So we'll turn it back over to you, Erin. Thank you.
Thanks, Clarissa. Thank you, Russell. With that, we will turn it over to Whitney Craig with the Health Department.
Hello, good morning. I will start off with our numbers that were reported yesterday. Total cases are at 6,726. Total isolating are at 1,047. Are recovered are currently at 4,321. Under investigation, 954. Unable to locate refused is at 279, and our deceased are currently at 125. While trying to prioritize towards the greater good of our community, we have decided that we will start releasing our faxes received that are still pending investigation. And that will be a separate number than what I just read off. Hopefully with this additional information, we can be transparent and release this information to the community and hopefully help individuals make better decisions and make better informed decisions in the coming days. So the hope is that today we will be able to do that from the 6th through the 18th, since the last date that we did receive was the 5th. Now, these numbers are just going to be raw data. It's going to be the faxes that we've received. So once we've actually worked the day's cases, we'll have a more accurate number of which of those cases actually do belong to Midland and are not duplicates. Sometimes we do see those if somebody tests that one entity on a Tuesday and then tests somewhere else on a Thursday or Friday. So we do see that in addition to just regular duplicates from the faxes coming in multiple times. We will try to weed those out before we release the numbers, but there the possibility that will happen. So again, it'll just be raw data. We have also had our own workforce setbacks, but we are waiting, and I had mentioned this last week also, waiting for additional staff from the state. So that is looking promising. In addition to the ones that they've already received, or they've already sent us and we've received, we are expecting more to come in. So that's going to be very helpful for us. I did want to read from the scientific brief from the CDC regarding community use of cloth masks to control the spread of SARS-CoV-2. I like this article because it did talk about actual real-world effectiveness of community masking, including the human studies of masking and SARS-CoV-2 transmission. So one of the real-world stories that they included was an investigation of a high-exposure event in which two symptomatically ill hairstylists interacted for an average of 15 minutes with each of 139 clients during an 8-day period, and found that none of the 67 clients who subsequently consented to an interview and testing developed infection. The stylists and all clients universally wore masks in the salon as required by local ordinance and company policy at the time. Another example that's given in this article is a study of an outbreak aboard the USS Theodore Roosevelt, an environment notable for congregate living quarters and close working environments, found that the use of face coverings on board was associated with a 70% reduced risk. The prevention benefit of masking is derived from the combination of source control, that's you being infected and not spreading it to others, as well as personal protection, that is you being safe from infected individuals for the mask wearer. When combined with other non-pharmaceutical interventions, which are what we've been saying from the beginning, which is your social distancing, your hand hygiene, as well as making sure you're in areas that are adequately ventilated, such as outdoors, or you're not crowding too many people's places. So I did want to share that. That is available on the CDC's website. That was updated on the 10th of November. So if anybody's interested in reading more, it's a pretty long article, so I didn't want to read everything. So that's available for you to also read. As the health department, we are a registered COVID-19 vaccine provider. So hopefully once the vaccine's available, we will be able to distribute that. And again, once more information is known, it still is an evolving situation. So once we have more information on that, that is something that will be shared with the public. Of course, we do still provide the flu vaccine 6 months and above. So please get your flu shot. We are available for appointments, so please call in and get scheduled for that. We have been working with various providers in the community also, so that we have a robust provider list to be able to distribute the COVID-19 vaccine once it is on the market. And of course, as always, please remember your 3 W's. Wear your mask, wash your hands, and watch your distance. I don't know if there are any questions.
All right, Whitney. The first one is, what are the main underlying conditions you are seeing when patients get very ill or pass away?
So our main underlying conditions that we have been seeing are obesity, diabetes, and hypertension. Of course, these are not all inclusive. I mean, so the list is staggering of what we're seeing, but those just from the recent, and I'm looking at the recent deaths we've had, those are attributing factors.
If a person is exposed, how long should they wait before getting tested if they are not showing any symptoms?
So that's a good question. Who asked that question?
That was from the hospital.
The hospital? Yeah, so people think that once they're exposed that you immediately need to get tested, and that's just not how it works. The normal incubation period for the virus is going to be that 2 to 14 days. Of course, we do see people that do become symptomatic even in that 2 days, some people as late as the 13th or 14th day, but there is an average amount of time right there in the middle that 7 to 10 days that people usually present with symptoms. The recommendation is still to test once you're symptomatic. If you've been exposed, that's just so you don't get a false negative. If you're not asymptomatic, the chances are you probably aren't shedding as much, and or not. I don't want to misspeak, but if you test too soon, there just might not be enough of the shedded virus for the test to pick up. So that's why they tell you to wait until you're symptomatic to get tested. You still want to isolate the full time, even if you aren't symptomatic, because asymptomatic spreaders are a huge problem for this virus. And for dealing with the pandemic, there are people that aren't presenting symptoms, and they're spreading the COVID to other individuals who may present symptoms and then end up even worse than the person that infected them. So I don't know if that answered the question.
The next one comes from Stephanie at CBS 7. She says, good morning, Whitney. For clarity, are you saying the health department is reverting back to its old case reporting? Also, for transparency, what sort of setbacks has the health department had?
No, we're still going to report once the day is complete. We're going to stick with that, but we're also going to report what we received out. So that'll be something, and we're going to work on that so that it doesn't, the numbers don't just come out and scare everybody. We're going to work on that so that it is as transparent as possible. And in regards to setbacks, Stephanie, we've had quite a few. A large piece of it is that, of course, our workforce and trying to get a robust amount of staff to be able to respond to this while not taking from our current clinical staff. We still want to be open to the public to be able to provide the services that we've provided pre-COVID, but also have our response to the pandemic. So those are two separate arms of what we're doing. So staffing has definitely been an issue, and getting people to show up, even first day interview, that's been an issue. What we do is very intense. We operate 7 days a week, and albeit that staff are not expected to work 7 days a week, some still do. And so sometimes that's a little daunting when we hire on somebody new. So sometimes we'll get staff in that'll only last a few days or maybe a week. So it's trying to get people in, get them trained. Space has been an issue. I don't know if you're familiar with the health department, but we're kind of landlocked. So we're trying to expand so that we have more space. But in regards to staffing, the state has helped us out different organizations or different departments within the city has helped with that, as well as our IT department and human resources have been really, really helpful.
Okay, now Violet Trevina with News West 9 has some questions whenever you're ready, Violet.
Whitney, good morning. Couple of
Violet, we can't really hear you.
Let's see. Can you hear me now?
Yes.
Okay. So I have a couple of questions. You mentioned some stuff about the vaccine, and we just spoke to Midland Memorial Hospital a few days ago. We were talking about, one of the vaccines that's coming out requires an ultra low freeze, about 85 negative degrees Celsius. Do you guys have that at the health department, or is there anything you're looking into to acquire one?
Well, actually, that's a great question. We are looking at purchasing one. The packaging that they actually send the vaccine in is meant to keep it at that temperature for 15 days. And so then you send the packaging back and they'll recycle and send more. So they've got a system set where they send you what you need to keep the vaccine at that temperature. It requires dry ice and switching it out. And I mean, it is quite cumbersome, and so that's why we are going to go the route of purchasing an ultra cold. But the packaging does provide that type of storage required.
Okay, and then once you guys are able to get this, about how many vaccines can it hold, or how many would you be looking at purchasing? Just one?
Well, the packaging that they send it in it's around 970 doses. So we'll have that to give out, and there's a shelf life of 6 months. So we just want to make sure that with the vaccine being so scarce, we're making sure that we're using that and we won't have to dispose of it. So at this time, we're going to, and they call it a pizza box. I guess it comes in a box. So we'll get one pizza box at a time.
Okay. Now, another question I have, not necessarily vaccines, but we're looking at the Eli Lilly and Company antibody treatment. I'm not even going to try to say the name, but, we have Governor Abbott coming out to West Texas today, up in Lubbock, and he's talking about this distribution, looking at Texas being the state with the second highest distribution in the U.S. Have you guys been in talks with the state? Are we receiving that here locally, or is it going directly to hospitals?
It would go to the hospitals, yes.
Okay.
The distribution of treatment would go to the entities that provide the treatment, whereas the vaccine would be more preventative. So that would be something we'd definitely be involved in.
Okay, and then going back to the freezer, do you guys have a timeline of when you would be getting it?
We're actually working on expanding our lab space. So prior to, today, I don't know if you guys can hear all the construction in the background because it's right outside my office, but we're working on getting that expanded. So we have an electrician out today. They were here yesterday, they'll be here today. So as soon as they can verify that we have the correct outlet with the correct voltage, we can get that in. When it comes to delivery, I imagine they're in high demand now. Fingers crossed, it won't take too long for it to get to us, though.
Okay, thank you. That's all I have.
Thank you.
Thanks, Violet. And now we will turn it over to Scott Pickey with CBS 7. Scott.
Hi, Whitney. We appreciate you being on the call this morning. How many employees do you know are out? There were 8 out here in Ector County yesterday. I was just wondering how many you had out this morning.
We currently have 4 out.
Okay. And are you running into any roadblocks that you know of trying to contact trace people from 12, 13, 14 days ago? Because I don't even remember what I had for lunch yesterday, much less who I ran into 2 weeks ago or where I was or who I was talking to.
Well, believe it or not, Scott, when we're dealing with the people that pick up the phone, because that's going to be a big issue also, which we're also working on. We're having caller ID issues, so people aren't answering our call. So we're working on getting that rectified so that people realize that we are the health department. Please answer the call. Please return the voicemail. But when you get something like COVID, when you get an infectious disease, your mind starts to go, okay, where could I possibly have been exposed? What did I do? Who was I around? And so those type of things are already going through people's minds. And so by the time we are able to get a hold of them, they've already played it out in their heads, you know, where they were at and who they could have potentially exposed.
Good. Finally, are y'all able to continue with restaurant ratings with the pandemic?
We are, yes. Our environmental section is still dealing with their normal. They're doing the restaurants, the daycares, the child care, the septic systems, foster care. They're still doing all of that. But in addition to that, we are getting complaints about, I went to this restaurant and the servers aren't wearing masks, or I went, you know, so they're dealing with that also.
Sure. Okay, that's all I have. Thanks for answering our questions this morning.
Thank you.
This next question was asked by the hospital, and when I say it's asked by the hospital, it means they're asking it from their Facebook page, just for clarification.
Okay.
They asked, is there anything the public can do to help the health department, such as volunteering to help with contact tracing?
I really do appreciate that, the request. And honestly, what the public can do is just follow the recommendations of this group. Wear your mask, watch your social distancing, and make sure you're washing your hands, washing high-touch surfaces. To be honest, I'm very concerned of what it's going to look like after Thanksgiving. And I really want people to take that into consideration of what having a holiday function would do to our community as a whole. Thanksgiving is my favorite holiday. I love to eat, so I love it. But I am not going to be around anybody this Thanksgiving. And it's a difficult decision to make, but I have to practice what I preach. And you have to think of this as an approach for the whole community. And Russell spoke before me, and the hospital needs us to join together and make sure that we're doing the best as a community, to make sure that although the holidays are coming, we don't forget that we are still in the midst of a pandemic.
Okay, and now Stuart Dreen with the MRT has raised his hand. Stuart, whenever you're ready.
Morning. A couple questions. What was the reasoning you got away from the type of reporting you were doing on daily cases?
It was the belief that it was causing some confusion, that we were reporting multiple days. So if we had a day that didn't have that many cases and we were able to start the next day and report all of that together, it was causing confusion. So there was conversations that releasing the full day that came in would be a truer picture of what was received or what was sent in to the health department.
And just to be clear, you're going to be sending all of the cases from like the 6th through the 18th at one time?
We'll break them down. It'll be daily. It won't be just one large number. And like I did say, we will try to format it so that it is as clear as possible that these are daily faxes, daily cases received, not one huge, okay, this
okay.
is.
No, I appreciate your help on that. I was in clarifying that. Thank you so much.
You're welcome.
All right, Whitney, this will be the last question for you. It comes from Danny. He asks, how are you investigating claims by inmates at the Midland County Detention Center that there's an outbreak of COVID-19?
We work very closely with the county, and we're in constant communication with them and their cases and the inmate population. So that's something that we stay on top of. Anywhere that has multiple cases, that's priority for us. So we stay on top of that. So any cases that are within the detention center, we're working in close proximity with the county to resolve or to assist. I mean, again, the only thing that's going to resolve this is once the virus is gone. But we are working in close proximity to make sure that we can be of assistance and helping in any way possible.
Thank you, Whitney.
Thank you.
With that, we will turn it over to Katie with MISD.
Hi there. Katie Atkins, Chief of Staff, Midland ISD. Report a couple of ongoings with the district. Last week, Midland ISD had 112 new COVID-19 reported cases among students and our staff. This is on pace with the previous week. In our November numbers, they're continuing to dwarf weekly totals from any other time. We are also saddened to share with you that we have lost a teacher at Midland High School, Mr. John Anthony. It's always difficult whenever a faculty member passes, a student passes, anyone. But we sincerely extend our condolences to those he impacted throughout his educational career. With that, we make sure that we are supportive and responsive to the needs of our staff and our students during this time. So our counseling department is on site and on call, prepared to support any of our staff and students who may need additional support during this time. So I'm going to transition right now to some of our responses. That leads us to what our surge plans are. And last week, one of my colleagues was asked about what the district surge plans entail. We're in that right now, and we're taking a range of steps in order to respond to the conditions that we see. First, we are deploying our central office staff to cover our classrooms where we have absences due to COVID. We realize that COVID is impacting everyone, and MISD is not immune from that. Last Friday, we sent 60 central office folks out to campuses to provide support. This week, we've been sending roughly 15 to 20 people out each day. And this is something that we're going to continue to do as we continue in our mission to educate our kids. It's what we stand for. It's what our organization, from the top to the bottom, all the way through everyone, that's our goal and that's our mission. So we will continue to support and educate our kids. We've had our payroll clerks, we've had district photographers, we've had all sorts of people going out to support our kids during this time. We're committed to doing this and keep going. We have also deployed our remaining central office staff to become additional in-house contact tracers. That's something that we have been doing since the beginning of all of this. We've added 18 central office staff contact tracers to assist school nurses. This is not additional positions, but rather using some of our existing personnel to provide this additional support. Our nurses have been working overtime to trace the contacts of the 100+ cases we are seeing each week. And when you consider that each single positive case could have as many as 50 close contacts that need to be called, you can imagine how immense that workload is. So our school nurses are true unsung heroes. If you see one, you have the opportunity to speak to one of them, please let them know that their work is appreciated, because we could certainly not do this without their dedicated support there. We do contract tracing because it's the right thing to do. It helps relieve the burden on the number of people quarantining. We can be more specific with those who do need to quarantine and those who do not. Just for clarification point, just because one person in the class has a positive case, we do not automatically quarantine the whole entire class. We are able to keep the quarantine numbers lower through our contact tracing process. And finally, we continue to require that all students and staff are wearing their masks. We have hand sanitizing stations throughout our buildings, and we strongly encourage our students and our staff to stay home if they do not feel well or have possible COVID-19 symptoms. As we prepare to go into Thanksgiving break, I'm going to echo the message that's been shared through our Midland Health Department and our hospital to exercise vigilance and best practices as we mitigate for this virus that is continuing. Our ability to do this significantly will impact our public health, and we want to make sure that we are being a part of the solution. So with that, I will be glad to take any questions.
Katie, the first one comes from the hospital through their Facebook page. They ask, there have been some rumors that kids will go all online after Thanksgiving. Is this true?
So currently there is not a provision by TEA to allow a district to go completely virtual. We will continue to provide our virtual option through the Midland Online Academy and also in person. With that, it's important to understand that the TEA, the Texas Education Agency, does update their guidance and update what's allowable. We're looking forward to hearing further from the commissioner today. He does provide weekly or every other week some calls to district superintendents and district staff, and so that's something that we're not sure what further guidance will be at this point in time, but I can tell you right now that is not something that is allowable per TEA to just completely shut down a district and turn to a virtual option. There is a difference between last spring. Last spring was a governor's executive order, and that's why we shut down. This is a different situation because we are working to maintain, and again through our the Texas Education Agency, our governor, and our state government, wanting to keep schools open. So we're continuing to adhere to that, but with the understanding that guidance and requirements and mandates do change, and then we'll be responsive to what those are.
Okay, let's see. I don't have any more in the chat. Media, raise your hand real quick if you have any questions. If not, we will move on. Okay, Stephanie has a question. We'll give her a second to type down. All right, Scott, whenever you're ready.
I'm ready. Katie, good morning. MISD reported yesterday that last Friday you had the most teachers out in school history. A lot of them came back on Monday. The cover answer for why they were out was COVID. If you have COVID, you're not out for one day. So do you feel that these teachers were out Friday, some of them protesting having to go back to school on Fridays? Was that part of the message, you think, of so many teachers being out last week?
So we do know that we had a number that were in quarantine. We do have a number who might have exhibited symptoms and then got tested. I can't speak to each and every absence that we had on Friday, but we saw the need and reacted by deploying our staff so that we could continue on with our instruction for students.
Okay, that's great, but you didn't answer my question. Do
I
you
know,
think
because
any of those absences were due to protesting having to go back to school on Friday?
We don't ask teachers if they're absent because they're protesting. So I can't answer that question to the degree that I think that you're looking for, because I don't know it.
You have to acknowledge that you're not out for one day if you have COVID.
That's true. Yes, and we're aware of that, but the reasons behind that, I don't have the reason behind why each and every staff member was absent on Friday.
Cool. That's all I got. Thank you.
Stephanie, do you have a question?
Yes. Can you hear me?
Yes.
Cool. Katie, I had a quick question. So how does central office plan to cover classrooms when you guys are falling short on being able to send out your personnel?
So right now, our personnel and I'm talking about district central office personnel, we make sure that we are covering the scope of the need. And first and foremost, our students are the need. You know, if a teacher is not available to come in because they are sick, because they're quarantining, that's the support that we're providing. With that, there's also district central office that happens at the central office that we're also committed to doing. So that does require people to take on additional responsibilities, and that's been something that we've been working towards, and we will continue to do, understanding that this is a very unprecedented time, and maintaining our operations and the education of our students is incredibly important, because that's why we exist.
Yes, Katie. Well, I was actually looking for more of a plan, because we see that, and we also say that we're in unprecedented times, but this is a growing problem, and I know you guys just can't keep on continuing to send out your workers. What are we going to do about the classrooms that are left uncovered? What are we going to do about the students? Where are they going to go? Who are going to teach them?
So to answer that question, what we do have a process in place. At the end of each day, we have a team that works together to see which students are, or not students, but what staff members are out, what campuses are in need of coverage. We work collaboratively with our principals to make sure that we are providing that coverage. We are going to do that as long as it takes. And so, for example, you might have a group of people who are quarantining, and they might all go out and quarantine at one time. That also means that the majority of them will come back all at one time. So that's been an ongoing process. But as far as being able to have a system, it's got to be a system that is responsive to the needs that we see that day, or that upcoming week. And so that's why we convene a team to work through and review what those absences look like, the number of absences, and that's our ongoing process.
Thank you, Katie.
All right, Katie, thank you. That was our final question. And with that, we will turn it over to Judge Johnson.
Okay, Terry Johnson, Midland County. I'd be remiss if I didn't reiterate what we know, and that's wear a mask, social distance, keep your hands clean and disinfected, but also, disinfect your workspace. Those are highly important things that we can't say enough. It's kind of like a bad commercial. After a while, you tune it out, but those things need to be said over and over by all of us. The current condition, we all know, is the worst it's ever been. We've got Thanksgiving coming up. Not trying to put fear in anybody, but it's just the reality. With the hospital being essentially maxed out, we're going to have issues because of Thanksgiving. We don't just have Thanksgiving. We've got Christmas coming up shortly thereafter, along with New Year's after that. So we could be poised for a real serious situation. The bright side is the news is reporting that hopefully there's going to be the possibility of a vaccine in the very near future. So hopefully with what's coming up, maybe something good will come after that. Take this time to thank Russell and his whole staff at Midland Memorial Hospital for everything they're doing and all the sacrifices they're making to take care of all those folks that we love, family, friends, co-workers, everyone. And I'd ask that everybody else offer their thanks and offer up a prayer for those folks along with their families. I do it every night. I applaud the city for all their support, and especially the mayor and the council for their leadership. We as Commissioners Court will be meeting on our Monday meeting. We'll be looking at our ability to accelerate what we can do to support the hospital, to support the city, and what we can do on our end. We've got a lot of things we have in place, but we want to see what we can do. We're working on a pandemic policy and hope to roll that out in the very near future. I want to reiterate that as a county, we're here to cooperate with the city, the hospital, the state through this crisis, and do all we can to be a help to get us through this. And with that, I'll open it up to any questions.
All right, this comes from Felice Romero at Big 2 News. She asks, viewers are calling and saying that there are positive cases of COVID-19 in the Midland County Jail. One caller said specifically in the women's cell, and they are not given any PPE, only a mop and some water to disinfect. Can you comment on anything the county jail is doing to protect inmates, or why these viewers are calling and saying they aren't given PPE?
I know for a fact they are being given PPE. I'm in direct contact with Sheriff and his folks. Everything is being done, literally being done, to ensure their safety, ensure the safety of the folks that are guarding them and watching over them, helping them. I haven't had that concern brought to my attention. I'll definitely be looking into it, but I don't want to discount somebody's concern, but our jail and the people in the jail are a whole lot better than that. They really are. But I'll look into it.
Okay, we'll see if anyone else has any questions. Scott Pickey.
Hi, Judge. Good morning. With the numbers that Mr. Myers shared this morning, if we go 5 more days at this status, occupancy has to go back to 50%. Are you prepared to do that?
Yes, sir. As a county judge and as a county government, we are direct answerable to the governor of Texas. We're an extension of the Texas state government. And so if he's dictated that, then that's what we have to go by. And yes, that's what will happen. And that's why it's imperative, folks, do what we can to keep from having to go to that. I know there's a lot of folks doing what they can, but we just gotta take care of ourselves. We gotta take care of those around us. And hopefully that in turn will keep us from having to shut down to a lower level. I don't want to see it, but if we get to that, then I've got to do what the governor says.
The governor also has issued a mask mandate, but you've chosen not to follow his order on that. Why is that?
Well, it's not that we're not following it. I think every time you see me speak, you're going to see me encouraging people vehemently to please wear your mask. That's what it's going to take. I've said it in an earlier interview. It doesn't get said. It's probably not a can of worms I should open, but do we as a community, do we want to turn everybody into calling in on everybody? Do we want folks, getting 6 or 7 calls from Walmart that somebody on aisle 7 is not wearing their mask? The enforcement part of it would be an absolute nightmare. I've had questions to me, well, look at all the money it would raise. Well, it might create some tickets being written, but if somebody doesn't want to wear a mask and they would rather accept a ticket, are they going to pay the ticket? Now that creates another issue. Now we've got a collection, we've got a law enforcement, we've got a Gestapo mentality. I think we as a society will do what's right if we know what we need to do, and that's the approach we would like to take.
You say that, but the numbers keep going up. So this new phrase of personal responsibility apparently isn't working.
It's a very good point, but I don't know that writing everybody that's not wearing a mask a ticket is going to accomplish. I mean, if you just literally look at the scope of what would be involved, the manpower, the phone calls, the people answering the calls. You call them about somebody in Walmart on aisle 7, by the time an officer got there, that person's already checked out and gone home. It's just an unreasonable, in my opinion, it's an unreasonable, unreachable goal. We just need everybody to do the right thing.
Did you agree with the cities?
You're going to have folks that don't do the right thing. You've got a law wearing seatbelts. You're going to have people that don't wear seatbelts. It's just going to happen. So.
Oh, we see it every day: seatbelts, speeding, whatever.
Yes.
But you don't think adapting that mandate to what the city talked about earlier this week about ticketing businesses themselves, if they're not mandating masks at the front door, you don't think that would work either?
Punishment is one way, and fines are a punishment. And that's one way of dealing with it. And I'm really hoping that this next Monday, the Commissioner's Court, we can discuss that. But I'll look at another way. Why don't you hang a carrot out there? If a business is got a sign on their door to say you have to wear a mask to enter, if they've got hand disinfectant available when you enter, if they've got masks available, if you don't have one, if they've got the 6-foot marks at their cash registers and aisles going one way, if they're doing all the things that are possible, why don't you reimburse them $500 to help offset the cost of some of those mitigating things they're doing in their business? Possibly we could do this through our CARES Act money. These are things I'd like to look in. I'd rather reward people for good behavior and go that way.
Thank you, Judge. I appreciate it. Those weren't easy questions, and I appreciate your time this morning.
You bet. Thanks.
All right, Judge Johnson, Mitch with Marfa Public Radio has raised his hand to ask a few questions. So Mitch, whenever you're ready.
Hey, Judge, I just want to follow up on a few things you just said. You said, enforcement would be a nightmare because of all the calls, and a mandate could create a Gestapo mentality. Doesn't that kind of language undercut the actual danger that COVID-19 poses to the community of Midland?
It's possible, but again, I go back to, we don't have enough officers, whether it's in the county, the deputies in the sheriff's department, or law enforcement, police department. I don't think we have enough people. I don't think we can hire enough people to do that, to take care of that. It's a great mandate, but it's unenforceable, literally. So I'd rather take the other tack. What can we do to reward those who do the right thing? One of the rewards is maybe we'll be a safer society here in Midland, but if it takes monetary rewards to help offset the cost, because doing these things does cost money, cuts into the bottom line of businesses. So if we as a county government can do what we can with the money we're getting through CARES Act, if we can make that available in some form. I don't know if we can or not. That's things I hope we look at next week, Monday's meeting, and that's the approach I'd like to take.
Well, I guess, how do you respond to people? I mean, seatbelts and speeding were just brought up. The sheriff's office doesn't catch everyone who speeds, but they still issue tickets. Like, what do you say to the argument that why can't a mask mandate be somewhat similar to that kind of mentality for having a policy in place to protect public safety?
Well, the policy is in place. The governor has issued a mask mandate. I don't need to issue it or not issue it. The governor has issued it. It's in place. Choose to go in and write tickets. You've seen that we, as a city and as a county, have chose not to do that. Doesn't mean the mandate doesn't exist. It's there. It's just we're looking at other ways to encourage folks to do the right thing. We're looking at other ways to deal with what is serious business. And writing tickets, I don't believe, is going to result that some folks think it will get. It may do it, I don't know, but we will be discussing those kind of things Monday in our meeting. The city's discussing now, and I'm so proud to see that, and the county will be taking up the subject also.
And I guess this is my last question, but how do you go about choosing which laws to enforce and which not to? Like you said, the mandate is out there and you guys are just choosing not to enforce it. So I guess from your perspective, how do you make that calculus that it's appropriate to enforce speed limits, but not the mask mandate the governor set down?
Speed limit is not a mandate. Speed limit is law. There is a difference in a mandate and a law. And also, you may find it doesn't say you shall, which means you will. So we're doing everything we can. We really are. If writing tickets today would end this pandemic, I would start writing them today or having them written. But I'm going to tell you right now, we'd have to go on a hiring blitz to get it done. But I really think personal responsibility is what we've got to push. I sincerely believe most people will do the right thing when they know what the right thing is. And we'll get through this. We really will.
Well, thanks, Judge.
You bet. Thank you.
Okay, the next questions are coming from Stuart Doreen with the MRT. Stuart, whenever you're ready.
Good morning. Wanted to ask if the governor, if number of cases at Midland Memorial stays high enough, and then we fall into that 15% rule, and that forces businesses to cut back. Are you going to expect the law enforcement to write tickets, to write citations, to fine people for not being at 50 or being over 15% or whatever the mandate is also for bars?
Well, that's what we'll be talking about next week. We will be doing probably what we did before. The bars did shut down before when they were allowed to open. They did it the proper way. I'm confident they'll go back to as painful as it is. But if there's an egregious infraction, we will certainly address that as it happens.
Thank you, Judge.
You bet.
The next is Violet Trevina with News West 9.
All right, good morning. So I'm gonna, sorry to beat a dead horse here, but just going back to the mask mandate thing, I have a quick question because we have been talking a lot about the enforcement of it and, you know, how hard it would be to enforce. And I'm not saying, you know, we should or we shouldn't, but as city leadership and county leadership, is there not a moment when, you know, you stand up and say, this is what we should stand by, and this is what's going to make our community better? I've seen it with, you know, the mayor, and everybody is constantly saying personal responsibility. But I, as a news manager, you know, sometimes set a bar for certain employees and say, this is what your expectation is. And it doesn't mean that, you know, if they fail to achieve it, it's suddenly, you know, punishable to a full extent, but there's consequences. And it kind of sends a signal of, you know, this is what needs to be done for us to achieve our goals. So this might get a little confusing, but what I'm trying to say is I feel like there's a mixed signal and mixed messages coming from, you know, the governor has said, here's a mandate. And we had an instance, you know, back in the summer when that Dallas bar owner was punished, and then the governor kind of came back to the city and said, we're not going to put them in jail. So obviously, you know, there is a limit to what's going on. Do you think that as a county judge, there's a moment when you have to say, this is the expectation for our county, and it is a fine? And like you said, you're not going to be able to fine everybody. You're not going to be able to catch everybody who's not wearing a mask, but it at least presents a unified front of here's the expectation for our community.
Well, I understand the expectation, and we're doing everything we can, even by this meeting here, to from the health department, the hospital, me, you'll probably hear from the mayor. Expectation is do what we know needs to be done to help us get through this. The consequence is if we don't do it, we're going to end up in bad shape. We're getting there, so that's the consequence of not doing it. If writing tickets would end it today, we would certainly look at that very seriously. I said Gestapo earlier, vigilantism is what I would hate to see. There's enough of it that goes on already. I've seen a couple of instances where somebody really took offense, and if they thought that throwing a fit because a ticket was a bit, I mean, I really think we're opening a whole nother box of worms by doing this, and I think the majority of the folks are doing what needs to be done, and that's what will get us through this. I'm convinced of it. We're a free society, and I want to see us remain free. We got to do what's right, and what's right is what's been laid out over and over and over again.
Okay, thank you. Just a quick follow-up. So, you know, I know that the people that I see every day, you know, they wear masks. The people that I hang around with, people that I work with. But clearly, you know, when I step outside of my bubble of close friends and family, and I look at both cities, Midland and Odessa, I see the numbers increasing every day. And, you know, we were at a point when our averages were down to 14 to 20 cases per day. And now we're back to in the hundreds. or not even back to it, but, you know, for the first time, a consistent 3-digit number reporting per day. I guess what I'm trying to say is I'm not seeing the community doing what they're supposed to. Not everybody, and it's affecting, you know, the ones that are. So the consequence, like you said, is we're going to have to reduce capacity or shut down, or, you know, more people are going to end up in the hospital. Are we waiting for that to just happen? You know, if that's the outcome, we just wait for that consequence to get here, and now we're going to have to roll back to 50% capacity, 20% capacity.
I think one of the things, personal responsibility, if you go into a situation where masks aren't required and the majority of the people or half of the people or whatever percentage are not wearing masks, you have the ability to turn around and walk away. I guarantee our dollars that we spend at restaurants and stores and all the places we do our business, our dollars will speak highly if we quit patronizing the folks that aren't working safely, then, and we quit doing that, then those businesses will get the message and they'll change what they're doing. They'll change their way. That's what's going to get us out of this. Writing tickets will not get us out of this. If it would be doing it this today.
Okay. And I just want to clarify, last question here. Didn't quite understand. Were you saying if businesses who are accepting people who are, you know, not following the rules stop doing that, then that's a step in the right direction?
I think businesses know what needs to be done. So that's why we're kind of looking at them. Instead of hiring a whole bunch of county sheriffs, I'd like to implore the businesses to please encourage people to wear masks, make masks available. If they don't have them, make hand disinfectant available, do all the things we know we need to do. That's our front line right there, because that's where the most of us get together, is when we go shopping and do the things we do. So if those businesses will be our front line, that's a help. Now, if you go to a business and they're not doing any of that, turn around and go somewhere else. That will cause them to second think their inaction. And that's what I'm trying to say.
Okay, I understand. Thank you.
You bet.
I appreciate it.
You bet.
Judge Johnson, the last question for you comes from Danny. He asks, are you planning on having events at the Horseshoe?
We had a meeting last Monday. We had a special meeting for some other issues, and I had put that on the agenda. The court decided to allow the manager of the Horseshoe to continue doing business the way he was doing it. So I can tell you right now, I hold today's Thursday, is it not?
Yeah.
Every year, Thursday before Thanksgiving, I hold an event that has roughly 1,250 people in attendance. Plus we bring 20 heroes with their spouses from out of the state generally to Midland. We chose to not do that this year because of what's going on, and we chose it back in September, I guess. And now that we're in the height of what we're in, I think we made a tremendous decision not to hold our event. So that to me was my personal responsibility to take care of the event I'm doing. I would ask other folks to do the same.
All right. Thank you, Judge Johnson.
You bet. Thanks.
With that, Mayor Payton, we turn it over to you.
Aaron, thank you. I think we've set a record today for the longest press conference maybe in the history of Midland. I'm not sure, but
I really think we have.
I don't, but anyways, it's good to be with all of you again today. I'm sure you're going to have more questions than I'm going to have information that I'll give you up front. I want to leave you plenty of time to ask what questions you want to ask. I am, rather than discouraged, greatly encouraged by what has taken place since the moment the mask item was placed, or infamous number item 38 was placed on the agenda. Since that time, we've seen a city council to a person become incredibly more engaged in this entire process. We have seen more creative ideas on how we can partner with the hospital. We'll see more of those issues brought up this coming Monday. There'll be council members that are wanting to discuss other issues related to mandates, even though that wasn't passed this past Tuesday. That discussion is not out of the realm of possibility. I'm not saying that is it's going to happen or it's not going to happen. I think as I've been sitting here listening to the questions now, I just want to reiterate that for us as a city, we have gotten fairly used to sort of business as usual, and the hospital has sounded the alarm to us. Quite frankly, the state of Texas is sounding the alarm everywhere. The state of New Mexico, the state of California, the state of Oklahoma. You can list just about every single state, even the ones who have been more staunch and even the ones who have been more, I would say, policing of masks and fines are in the same situation. The reality is we are not going to control this virus. It is here. We are in the mitigation point, and mitigation simply means to slow the spread. And now the call is on for us again to do what we've done before in slowing the spread, understanding that we are in a position we have never been in before. I think we will look again this coming Monday at multiple plans. As you heard from the hospital, there are financial plans of how we're going to be able to increase the health and welfare of our citizens related to COVID-19. It is an extensive list of things we might be able to do as a city with CARES Act funding to help them. We have been in discussion with them. Our Unified Command Team, quite frankly, fired back up again today and preparing for the things that we can do. So quite frankly, again, everybody is ramping back up. Erin and her entire team have already been making commercials. Some of you are already ready to present those public service announcements. We are working on advertising. Lamar Signs is putting things out. We know business owners are paying attention as well. And I know after today, one of the things that will help our business community understand the importance of getting this message out is what we've talked about with Russell and what some of the questions just related to the judge were, which was, if we don't get some hospital numbers down, some emergency room numbers down, and emergency department numbers down below that 15%, then the governor is going to issue a rollback of to 50% of occupancy. And what I'm concerned, even when that occurs, and what also still concerns me about the enforcement of mandates is I know that many people in our community are very fatigued. Everyone is fatigued. And there's going to be I guess you could say there's going to be a fine line between what you do to enforce and what you do not do to enforce. I have no doubt that businesses, if they're told to go back down to 50%, most will, some won't, and then we'll have that issue. I've heard multiple stories of people working at various department stores and other stores who have tried to talk to patrons who don't have masks on, and it's sufficient to say those conversations have not gone well and have been very close to becoming violent. So that's what we're also going to have to deal with if we don't do what we're doing right now, which is increasing the message. I mean, you can look at this call that we're already on and how long this has gone and the questions that have been asked, the engagement of the entire city council, the ramping up of our city staff on multiple avenues in the health department, things that are being done. It's fair to say that myself and others really took for granted where we were and how things were, and the hospital has made it very clear to us where we are. Also important to notice what we heard a little bit earlier, which was, I think the number was 26% of people from out of county. So we've been one of those hospitals, one of those regions who has been able to take on the load from other places. That is getting close to a place, as you heard, within 2 minutes, they had to shut it down again. There's not a place in the state that's not stretched. And so even if we instituted a mandate tomorrow of any type, shape, or form that people couldn't even leave their houses, we would still not be able to mitigate what's happening. What's going to get us to mitigation is what got us to mitigation the last 2 times, which is the severity of the situation, which has been worse than it's ever been right now. People understanding what's at stake. And I also think that our business community understanding that from a state level, what's happening at the hospital, and our community understanding businesses are going to be harder and harder face not being able to be open if we don't get these numbers under control as well. And I'll end with this. I want to emphasize as well the caution as we go into Thanksgiving. You've already seen we canceled the Christmas parade. We canceled the Christmas tree lighting. We did that before we even got into these messages that we're into today. But Thanksgiving is going to be a critical time, and the holiday time is going to be a critical time. We're not approving events. We're not having events at the city level. And if you've tried to come to City Hall, you notice it's been locked down, and we're enforcing masks all over City Hall as well. So with that, I'm sure you have questions, and I'll be happy to take your questions.
The first question comes from Caitlin Randall at the MRT. She said, Mayor, you previously said you would support businesses that open beyond the allowed capacity. Mm-hmm. If the state mandates that Midland lower capacity to 50%, what will you tell businesses that they have to follow that?
Well, we'll tell businesses what we've been telling them all along, that what they're having to deal with is what the state has told them they have to do. If you'll remember, Caitlin, all the way back to when we stood at the Tall City Brewery, I said, whatever you do, you're going to have to do in opposition to the state. I'm not telling you to oppose the state, but I'm telling you that we're open. And so hopefully we won't get to that place where we have to roll things back. But I know if we do, I fully expect that all of our businesses that understand the seriousness of the situation will roll back to 50%. And as the judge said earlier, we'll have to deal with egregious violations or those who just continue to snub their nose at what is happening and what's being done. We really have not had that problem. Even from the point that I announced things several weeks ago. We haven't had bars all over town. I'm sure there have been some, so don't come back and say, well, what about this bar? I'm sure there have been, and there will be no matter what we do, but people have obeyed rules. People have set up social distancing. People have put up signs. And even when you go into restaurants today, they're still holding their capacities where they were. So we'll see what the community does if that has to happen, but our hope is that that won't have to happen.
Okay, we'll give them a second. Mitch with Marfa Public Radio.
Hey, Mayor, I just have a question. You know, how do you calculate the potential risk that people who are anti-mask may pose businesses and the public versus the actual danger the coronavirus poses Midlanders? Like, how do you balance that kind of, those two kind of things in your thought process? Because we hear about this potential, backlash if there was a mandate, and I'm just curious how your thought process on that and how you balance the two.
It's not a balancing act for me, Mitch. It's just dealing with the reality of one of the issues that's out there when you talk about mandates and when you talk about enforcement. It's not a balancing act. I'm not trying to offset one with the other. I'm just bringing up some realities that we see happening around the community. Those are things that we will have to deal with. And I've also seen various things happen related to where people are and the tensions of where they are and what they're trying to do. So it's not a balancing act. It's all of the above, and taking into consideration all those issues of public safety and also public sentiment and what we're having to deal with as we deal with this crisis.
Well, I understand that. I guess one is potential and one is actually happening. And I guess
no, they're both actually happening. There is a severity with the coronavirus, with COVID-19, and no one's denying the severity of it. There's also a reality of attention out there in the community of don't tell me what to do, and you can call the police on me, and quite colorful language used in various stores. So you're correct in the fact that the COVID-19 is much more serious than what happens to an associate at one of the stores around here who tries to do the right thing and is threatened. But both of those are real. The severity is definitely here. We're not downplaying the severity of COVID-19, but we're trying to also be very clear about what the issues are of how we have to mitigate this and the things that we have to do for enforcement.
All right. Well, thank you.
Mm-hmm.
Mayor Payton, this kind of goes along the same lines. It's from Caitlin again. She asks, can you speak about being in a leadership position during a pandemic and how you balance making decisions with a very divided opinions?
Well, Caitlin, thanks for the question. I think that every single person that's an elected official on this call, I guess that's just me and the judge, have been struggling with that greatly. And that's why, and I appreciate the judge talking about how he's bringing things before the commissioner's court. That's exactly why I elevated this issue on our agenda item with a mask mandate, which is because, and as you've heard me say over and over, Caitlin, I probably see you rolling your eyes as I get ready to say this, but my biggest complaint has been, and it's not just happening in Texas, it's happening all over, that we're not having a full debate among elected representatives to bring better ideas to the table and better ways to work through this than we brought to bear. And many people have written me and said, do this, do that. Why don't you do this? Why don't you do that? And the beauty of representative governance is exactly what's been happening since last Tuesday. The story is not the council turned down a mask mandate. The story should be the council has been reinvigorated to come up with answers from every single council person, every single person, every man and every woman, just one, who have been working on new solutions throughout email and throughout partnerships and with the hospital and with CARES Act. And so, Caitlin, it's the frustrating thing is that throughout this state and this country, people have thought that the person that's supposed to issue everything and do everything is either the governor or the judge or the mayor. When the reality is it's supposed to be all of the elected officials who have been elected to represent. It takes a little longer, I get that. But we're also 9-10 months into this thing, and it's been different 2 different times as it is this time. And so what I'm thankful for is at this particular pace, even talking to council members offline, and I'm not betraying any confidences, for all of us to say, you know what, I think we really just, to use this phrase, might have gotten a little bit lazy in what was going on. But now, as we'll even see coming up on Monday, there's much more creativity, there's much more engagement, and there's much more of a sense of urgency than just what's the mayor going to do, but it really boils down to what are we going to do as a city and as a county. So I appreciate the question, Caitlin.
The next question comes from Danny, and he asks, how much money will the city council give Midland Memorial Hospital once approved?
Danny, let me defer the answer to that question until after Monday. There's a number that's out there that we're working through. We've already heard the word transparency in this call. I'm not trying to reduce transparency. There's just things in front of the council right now with presentations, and so I'd rather not give that number until we get to Monday, and then that'll become public information on Monday. It's a substantial number, though. Let me be clear about that.
Okay, and now Stuart Jareen has some questions. Stuart, whenever you're ready.
Thank you. Good morning. Wanted to ask, because this is a question that I'm getting in response to my column today. Why did it take 8 months to have this discussion?
Well, because I think the last 2 times we didn't feel like we had to have that discussion. We felt like our community was responding to a very limited call and a very limited message from whenever we had spikes. I'd get on the air, or we'd write an article for the paper, or the judge would make some comments, and we'd see things reduce. This is different. It's different by a factor. It's more intense than it's ever been. So I wouldn't say it's taken 8 months to have this conversation. I would say this is a different conversation than the conversations we've had over the last 8 months.
Thank you, Mayor.
You're welcome. Stuart, that's it?
I can keep going if you want.
I'm just giving you a hard time, my friend.
Thank you, sir.
Sure.
All right, Mayor Payton, now we turn it over to Scott Pickey with CBS 7.
Okay. Hi, Scott.
Hey, good morning.
Good morning.
So far, it's been 8 months of talk. When do you predict action?
I disagree with the premise of the question that it's just been 8 months of talk. I think our community has taken action every time we've talked about what's needed to be done. Again, as I answered Stuart's question, I think we're in a different conversation right now, and we are contemplating and deliberating what new actions might need to be, because the previous actions worked for that particular time, and I think we're in a different season nationally. I think we're in a different season statewide, and we're definitely in a different season for the city. So I don't think it's been 8 months of talk. I think it's been 8 months of dealing with this, and we're in a new season of it.
And I would agree with you. There's been community action, but there has been no council action except for moving some CARES money around. Do you think the council in the next meeting or two will take some action? Your hospital is bursting at the seams. Your hospital CEO and Kit begged you to do something to help that hospital, and the council has done nothing yet. So when do you predict something will be done to take the pressure off that hospital?
Well, again, I disagree with the premise of the question, Scott. I don't think nothing has been done by the council since Kit Brittamus came before the council, and since we've been talking to Russell. I think what's happened is we first started intensely debating this new issue, and from that has become even more creative and better options that are coming before the council, so that when we do take action, it's not unilateral action, but it's debated and it's discussed and it's decided on action by an entire council to help the hospital. One simple solution that everybody thought was a simple solution from a mandate for me, now because of a longer conversation, is getting to even greater solutions and financial commitments to the hospital and to others. So I would say that the conversation is yielding results, and results will be coming down the line as well to answer the call from the hospital.
Okay, so you're saying talk is action.
No, that's not what I said. I said we are taking action. Part of that action is discussion, and there are items on the table that will be actionable, but absolutely having the discussions to get to the actions in this particular different season than the previous 8 months is exactly the action that needs to take place so we get to the solutions.
That's all I have, Mr. Mayor. Thank you.
Patrick, we have one more from Caitlin with the MRT. She says, you spoke during your campaign about the need for a paradigm shift in how Midlanders see themselves. Do you think there's a way to shift the mindset for those who say they won't follow COVID protocols, including wearing a mask?
Caitlin, I think we're all dealing with a paradigm shift right now in just how we deal with these situations, because none of us have ever even been in this paradigm. I, quite frankly, to just get right down to the meat of that question, don't know how you shift a paradigm from people who just say they won't do something. And that goes to when seatbelt laws were instituted in the 60s and nothing was enforced until the 80s. I'm always interested in that conversation about comparing this to seatbelts when it took nearly a generation to even get to a place where people would wear seatbelts. And so right now, with everybody being pressed the way they are, with the irritation that everybody's facing, it's going to be very difficult for someone who doesn't see the bigger picture, see that we could shut down by 25% in the next 5 days until it personally affects them. Unfortunately, I'm not sure that we'll get to that change. But for the rest, I believe the majority of the community is responding. I know I'm responding. I know our council is responding. I know people are paying attention more, and the discussion is elevated. So hopefully there'll be some peer pressure for those whose paradigms are very slow to shift in this regard.
All right, we'll give them just a few more seconds. All right, Mayor Payton, thank you.
Thanks, everybody.
Everyone, that concludes the Unified Command Team press conference. Thanks for joining us.